Morning. I'm Anna Stewart, and I am the chair of this third keynote session. It's so wonderful to see so many people here. You know, often you'll get a drop-off in these conferences between day one and day two, and if anything, I think there's more people here on day two. Well done, Don, to get them all along. It is my great pleasure to introduce Beth Drake from the Washington State Institute of Public Policy. The Washington State Institute of Public Policy has been mentioned quite a number of times. Don bought Steve Oss out a number of years ago, and his influence has obviously permeated much of Australian research, especially Australian treasuries, in the last few years. So we've now got Beth from Washington State who's going to give us a conversation. I've not met Beth before, so I'm really looking forward to it. I met her last night. I said, you know, have you been to Australia before? She said, yes, she came to Tasmania. And I said, oh, that's wonderful. She said it was very much like Washington State. And it wasn't just me. That reaction, there was like a couple of people at the table who looked at her like, what? And then she talked about cherries or something like that. And we were still a little confused. However, you know, despite the fact that she thinks Tasmania and Washington State are very similar, I'm sure she'll have some really wonderful things to tell us this afternoon. So, this morning still, sorry, there's Queensland time. So, without further ado, I'd like to introduce Beth Drake.
Okay, can you hear me? I've not been known for my loud voice, so let me know if you can't hear me. I do believe that Washington State is a little bit like Tasmania. You might not know this about Washington, but we actually have a desert in eastern Washington, and we have a rainforest in western Washington, so it's a little bit, you know, similar to Tasmania in that way, although we don't have wallabies hopping around. And the first time I saw one, I was very excited, so. So I'm here, I work for the Washington State Institute for Public Policy, and I'm very honored to be here to speak about the work that we do at the Institute. And I would be remiss if I did not acknowledge Steve Oss, who was our former director. He's now happily retired and not thinking about benefit cost analysis, and he's retired and doing carpentry and things like that. And I also want to acknowledge to my colleague Stephanie Lee, who was also, has been in Australia speaking before as well. She's taken over some of the main work in developing our benefit cost model. And then I also want to acknowledge too, we're a research group with about 21 or so people. We're rather small. We're actually the largest that we've been in all the years that I've been at the Institute. But there are a whole host of us who are working on all this work that we do at the Institute. So as a team, we've developed this benefit cost model that we use not just in the field of criminal justice, but also in other areas as well. So most of those that I won't really speak to today, but we look at public policies and how we can improve public policies in child welfare, substance abuse, mental health, and prevention, and all sorts of things. So, the Washington State Institute for Public Policy, we were created by the legislature in 1983, but actually before I get too far ahead, I should say we are Washington State, not to be confused with the other Washington, so just want to get that clear from the get-go. And we were created in 1983. We do nonpartisan research for our state legislature, so that's kind of what makes us a little bit, I think, different in that regard, is that we have all of our assignments get directed to us either directly from legislative bills, policy bills, or budget bills. And we also have a board of directors with bipartisan representatives from our House and our Senate, both Democrats and Republicans. So all the work that we do is either legislatively mandated or board directed and approved. So this right here is the Capitol in Olympia. Not in Seattle. That's probably the city that most people are familiar with, but we're about an hour south of Seattle, about an hour north of Portland, and our office is actually located right there, so we work very close, in proximity with the legislature and with legislative staff and members. So that's a little bit about what we do, and today I'm going to be talking to you mostly about all the work that we've done in criminal justice, but like I said, we look at a variety of different public policies and in all sorts of areas: mental health, public assistance, workforce training, development, marijuana legalization. We have a massive research project related to that. Washington State is one of the first states to legalize marijuana, and so we have a full-time researcher who's in charge of evaluating the effects of that until 2032. So we have a variety of skills on staff, people who have background in child welfare and people who are psychologists and statistics geeks and economists and all of that. And for me personally, my background is in criminal justice, and my degrees are in criminal justice, and in my spare time, I'm getting my PhD in criminal justice. So that's what I'm doing right now. Every day, every hour that I live and breathe, it's about crime. So in my spare time, I'm reading, when I'm not here at the conference, I'm reading my human trafficking book right now. So that's what I do, and I'll be doing that for the next few years. So I just wanted to give you some examples of the work that we do at the Institute for Public Policy, because probably most of you are pretty familiar with our benefit cost analyses, but we also do a lot of outcome evaluations as well, and these are all projects that I was involved in. So we do a lot of evaluation of programs and policies in Washington, looking at whether or not drug offender sentencing alternatives are effective at reducing recidivism, and are they cost beneficial? Looking at earned release policies, and are they cost beneficial? Looking at risk assessments in Washington, and which risk assessments have the highest predictive accuracy to predict recidivism. Looking at, I do evaluations of juvenile justice policies as well, programs and policies. I looked at kids who get automatically declined juvenile court jurisdiction and move into the adult system, and whether or not that's effective at reducing recidivism, and it's not. And then looking at violation behavior for people who are on community supervision, and whether or not the use of jail as sanction for violation behavior, whether or not that is effective, and domestic violence treatment. So those are just some smattering of projects that I've worked at in my tenure, the 12 years that I've been at the Institute for Public Policy, as well as a whole bunch of meta-analyses too that we'll kind of dive into a little bit more later. So the Washington State Legislature has asked, what programs or policies improve outcomes at less cost. So when we think about this, we tend to think about crime. At least the legislature is interested in crime, but we look at all sorts of outcomes. So to the extent that I can, examine or measure other kinds of outcomes like employment or substance abuse or all of those types of things, public assistance, use of resources, things like that. We look at all sorts of outcomes. So when we think the legislature wants to know, how can we improve these kinds of outcomes but do it in a cost-effective way? So our website, today I'm here to kind of talk to you a little bit about, I've had several people say, I'm excited to hear about your paper. I'm excited to hear about your paper. And I'm not here to talk about one paper. I'm here to talk about a variety of things that we've done at the Institute and sort of the research approach that we've taken, how we implement the work that we do, and how it has or has not affected public policy. So on our website, you can get access to our most recent reports and our benefit cost findings. And this right here is a snippet of our website where we keep our benefit cost results. So everything that I talk about today, that's just a a little sliver of some of the work that we do, and you can access the website for full results, and for results that are not just in criminal justice, but as you can see, the pointer is, yes, this one. So as you can see, we have, for all of our benefit cost results, each one of those tabs you can get to look at different programs or policies. So these are the ones that I work on at the Institute, and then for every program that we have on our website, you can look at you can click on each individual result to see what studies went into that meta-analysis. These are sort of the bottom line benefit cost results, but when you click on each one of these, you can see the studies that went into the meta-analysis, what the effect size is for that meta-analysis, and then a breakdown of the benefit cost results. So we have that available for all of these different topics, and I was looking earlier just to see, how many meta-analyses have we done, and I was counting on our website. We have 424 different meta-analyses on all of these topics, about 80 meta-analyses in both adult criminal justice and juvenile justice. And most of those meta-analyses say criminal justice, but most of them are really correctional policies. And that's kind of, most of the work that we've done in crime is really looking at the effectiveness of correctional policies. We haven't really received many assignments on looking at policing strategies or whatnot. Although there's a bill right now that's progressing through the Washington State Legislature. The Washington State Legislature is in session currently, so I was only able to get away from Washington for about a week because this is our busy time of year, so it's unfortunate I won't be able to take more advantage of the time here in Sydney to kind of look around and whatnot. But we're busy in session, and there's a bill right now that's progressing through the legislature that we might get a research assignment to look at effective policing strategies and whatnot. And for those of you who are listening to Gloria yesterday, she mentioned there's not a whole lot of literature out there on policing strategies, which is true. But thanks to Martinson's Nothing Works, there's a ton of information on correctional strategies out there. So I think that's one of the reasons why we've sort of gotten a lot of interest in looking at and evaluating correctional programs too. Also because, crime is expensive and incarceration is expensive. And so I think that there's a lot of interest from our state legislature in looking at those particular programs and policies. So just to look a little bit about how similar or dissimilar we are, we're similar in that Tasmania grows cherries, and so does Washington State, but in terms of population, we're a bit more dense in Washington State, although that's more on the western side of the region, and eastern side of the state is much more farmland and agricultural. But we have roughly about the same number of people in Washington State as in New South Wales, so you can kind of see some of the differences in our density there. And then in terms of crime, in the United States, we incarcerate a lot of people, and the incarceration rates are just starting to come down, but you can see that Washington State is not really the average state in the United States. We're on the lower end in terms of incarceration, but we do incarcerate, more people than you typically do here in Australia or in New South Wales. The other thing, too, is that I'm probably, safer walking around here in Australia than I am anywhere in the United States, for that matter. But so that's makes me feel good to be here in Australia. Not to minimize all the great work that you want to do, though, to bring these incarceration rates down. So just to give a little bit more so you kind of understand some of the differences between the way that we operate in Washington, although I'm always impressed with people who seem to know a lot about Washington or about the United States and how we operate. So you may already be familiar with this, but we're fairly decentralized. We have federal governments. We have federal jurisdiction over some offenders. We also have state jurisdiction over some offenders, and then also local jurisdiction at the county level. So we're very decentralized. In Washington State, we actually have 39 counties, in addition to the state system. So we're decentralized in terms of the police, with the exception of the state patrol, police, courts, and corrections. And then in Washington, we're a determinate sentencing state. Some states are indeterminate, I think, still in the United States, but we're a determinate sentencing state and have been since about 1984. So we have a sentencing grid, but there's range, within that sentencing grid of flexibility for judges to sentence. So felonies are the jurisdiction of the Superior Court, and misdemeanors are jurisdiction of the district courts, which is the local county jails. So that's how we're similar and dissimilar. So just to give you a little bit of background in some of this, Steve Raphael, he gave a great overview of the United States incarceration rates, but repeated exposure doesn't hurt things. So I'll give this to you again. You can see an incarceration rate on the axis there of rate per 1,000 people, and then we have data from 1930 all the way to forecasted out population. So in the United States, the incarceration rates started to go up around the early 80s, and part of that, is the get tough on crime, sort of punitive movement. Part of that is a move to determinate sentencing. It's a whole host of other reasons, but nonetheless, the incarceration rate in the United States, and this is just for prison, has gone up significantly, and it's starting to come down just now in more recent years. So it's about 4.5 people per 1,000. And then in Washington State, we're at about 2.5 people per 1,000. So we do tend to use incarceration for the highest risk offenders. About 65% of the current prison population are high-risk offenders, either high risk for violent offenses or high risk for property offenses. So I would say that it's quite likely that Washington State has got a good mix of people who are in prison in terms of using prison, the most expensive resource that there is for crime fighting, that they're using it for the highest risk offenders, and we'll kind of talk a little bit more about that later. But if Washington State had the same incarceration rate, if we were taking that sort of more punitive approach or just the approach of incarcerating people, we'd be spending about $675 million more per biennium. We operate on a biennial budget cycle in Washington State. So that's a quite expensive resource there. Just to give you a little bit more in terms of background and how Washington is a little bit different. Got crime rates here, and this shows the percentage change relative to 1980. So the good news is that in 2015, and these are the latest data, I think Steve even mentioned it, takes a while to get data from the FBI. There's a bit of a data lag. So these are actually the most recent data available. But crime is going down. So relative to 1980, reported crime rates are about 45% lower than they were in 1980. So that's the good news. The bad news is, though, that taxpayer costs in terms of household dollars spent on the criminal justice system are going up. So in 2007, it was about 116% more per household spent on the criminal justice system. So we updated this just a few years ago, and in recent years, costs have begun to come down, which is very exciting because, this isn't causal by any stretch, but you kind of got to wonder, are we making a difference? Are we able to, the goal is to keep crime rates low. How can we more effectively reduce crime and therefore reduce the cost of victimizations and the cost of criminal justice system taxpayer resources? Can we keep crime rates low but also control criminal justice taxpayer spending? So that's one of the main objectives that we do at the Institute for Public Policy. My colleague and I, Michael Hirsch, we're updating these cost figures. So we're in the midst right now of revamping our benefit cost model and what we call the crime model section of our benefit cost model, which is our monetization routine to sort of do these benefit cost analyses. So we're in the middle of that right now, and we've obtained new taxpayer data sources, so I'm excited that we'll be able to look at these trends to see where they're continuing to go. So, and we'll have updated findings. We periodically on our website where we publish our benefit cost results, we update those about once or twice a year. So we're going to be republishing all of our criminal justice findings. We have a massive push of meta-analyses that I've been working on with two of my other colleagues. And so we're going to publish those in about June or so. So it will be updated new information available. So at the Institute, we have a three-step research approach. And what we do is we look at, what works to improve outcomes. And those outcomes can be anything from crime to increasing high school graduation, reducing substance use or abuse. To the extent that that information is reported, in studies when we're doing meta-analysis, we code all of that information. But I will say, and this has been a theme that I've noticed throughout some of the presentations, is that criminologists and crime researchers have just a fascination with crime, but not looking at other outcomes. And I can tell you that, in all of my coding of hundreds and hundreds of studies, it's rare to see outcomes on offender populations that are not recidivism or crime outcomes. So it'd be great to see more outcomes like employment, things like that, because we do have the ability now to monetize. When you get an effect from that, then what's the benefit to improving employment or improving high school graduation, things like that. So we look at what's been rigorously tested in Washington or elsewhere. And there was a question, it may have been you, in one of the earlier presentations about John Tramburo's work and whether or not our effect sizes are applicable in Australia. And I would argue that they are, because we've had quite a lot of interest internationally, and we keep track of studies that are tested, in non-U.S. Sites, and then studies that are in the U.S. And then we'll do a regression on the meta-analysis to see whether or not there's a difference in U.S. versus non-U.S. sites. And we tend to not really see much of a difference, so we don't really report that much anymore, just because we have not really seen much of a difference. But we do sort of test for those kinds of things. So. The second step in our research approach then is to do the benefit cost analysis. So this is sort of another theme that, I've been hearing about, and Jerry mentioned in his, presentation too, is that, he was saying, yes, this is an effective policy, but at what cost? You're avoiding, I think it was 17 crimes, something like that. Yes, it's effective, but at what cost? Because we see that often where a program is actually effective, but it's not cost effective. And so if you have a program that is beneficial, but it's highly expensive to deliver, then that's looking at the benefit costs is sort of another way of looking at effectiveness. So I think it's something that researchers are starting to look at a little bit more, but there's not a lot of benefit cost analyses out there. So I would argue that it's a key and critical piece, especially for public policy, to not just be looking at outcomes, but to also be looking at cost effectiveness as well. So all of these results, our benefit cost model is keyed and tuned to Washington State's population. So all of the inputs that we have in our model are about the criminal behavior that's happening in Washington State and Washington State offender populations. And so we're modeling we're modeling that. So we look at, in our benefit cost analyses too, not just what pays off for taxpayers, but also to victims of crime. And so we have a way to look at, most of the benefits that you'll see in some of these findings of these programs. About 2/3 of the financial benefits actually come from reduced victimizations, because we put a monetary value. We use some national research literature by Catherine McAllister to put a financial value on the cost to crime victims. So we're not just looking at taxpayer resources saved, but also resources saved for crime victims themselves. And then the third, sort of key aspect is to look at, a portfolio approach. And I think you might hear the term down here about justice reinvestment. And that's this portfolio approach where we can then look at, so if you invest in these kinds of programs, and this is much what John Turnbull was talking about in his presentation earlier today, if you take money and you invest it in a variety of programs, then what's the whole effect of that entire portfolio, that sort of justice reinvestment? And then we also look at the risk for failure. So one of the things that we've found to be important, especially since our benefit cost model, we're doing this sort of simulation modeling, is to put variation around these inputs to see, when all of the inputs vary, either, by the effect size, and you have the standard error around the effect size, or variation in cost estimates. When we allow all of these inputs to vary, we run our benefit cost model, not just one time, because that would be too easy. We run it 10,000 times in a Monte Carlo simulation to look at, what's the percentage of time that the benefits don't exceed the cost, so that we have a little bit of sensitivity around those estimates, And I think, when Gloria was talking yesterday about that Emmy model, which I really found very fascinating, one of the things that I thought, well, I would like to call that Emmys and add sensitivity on the end, because that seems like something that everybody really ought to be doing, is not just, looking at or evaluating or looking at a program or policy in one way, but how is, the way in which you're actually looking at that policy, how are the results potentially sensitive to the research design that you've used? So we actually do quite a bit of sensitivity testing these days. So there's two ways of determining what works, and most of you are all researchers, so no need to go into this too in depth, but we do either an outcome evaluation, and I showed you a sort of smattering of those outcome evaluations that we've worked on. So for example, does the cognitive behavioral therapy in Washington, the one that the Department of Corrections uses, does it reduce recidivism or improve other outcomes? Or we do a meta-analysis, which is a quantitative way to systematically review the research literature. So the important thing about meta-analysis and the way that we do it at the Institute, and how we're maybe a little bit different from other, I would say true meta-analysts. Like Mark Lipsey he's a true meta-analyst. They set sort of inclusion and exclusion criteria, and they review those studies then that go into their meta-analysis. Because we're providing advice to our legislature, we want our advice to be sound advice. And so what we try and do is we have our own research criteria, and we rule out the studies that don't meet our minimum standards of rigor. And that is just simply because we want to be able to provide this reliable advice to our legislature to say, we can say, with pretty good confidence that these programs are causally effective at improving or not improving these outcomes. So our minimum standards of rigor are, you got to have a comparison group. We don't include pre-post research designs just because of the threat of time with pre-post designs. And then sometimes, even if you have a comparison group, it might not be a good comparison group. There might be important, statistically significant differences between those groups. And so, and there might also be selection bias issues. We have our selection bias antenna up every time we're reading a study because we really want to be able to be confident in those results that are in the meta-analysis. So we follow the methods of Mark Lipsey to produce a standardized mean effect size, and then for continuous outcomes, and then we use Decock's transformation for our dichotomous outcomes to transform so that they're comparable to the continuous outcome measure. So as an example of doing a meta-analysis on cognitive behavioral therapy, and we just updated this cognitive behavioral therapy meta-analysis and found 42 studies that met our minimum standards of rigor to be included in. And we looked at a variety of things too. We often do meta-regression after we've done a meta-analysis to look at, are there potential moderating or mediating variables that we can glean from the research literature to see whether or not there are certain factors that either heighten the effect, make it more effective or less effective. So for example, we looked at, whether or not manualized programs that are CBT programs, are they more effective, these sort of name brand programs, than these homegrown cognitive behavioral programs? And what we found is no, it doesn't matter, that cognitive behavioral programs are still effective. And that's actually quite similar to some research that Mark Lipsey has also done as well. So just to kind of show you of our cognitive behavioral therapies, on here we plot the effect size. So this is a reduction in recidivism and an increase in recidivism. And all of those studies that we include in the meta-analysis, it's greater than 33,000 participants in CBT. And so what we found is that, some studies have an increase in crime, and these error bars show you if it crosses the axis, it's not statistically significant. Some of them have a big error bars, and those are typically the studies that have really small ends. So that's one of the disadvantages of looking at just one study, is sometimes you can't achieve statistical significance with one study. We found a whole bunch of studies that showed no effect on crime. And then we found a whole bunch of studies that were effective at reducing recidivism. So I love this chart for many reasons. One, it highlights, why you can't cherry pick studies, why taking a systematic review is a sort of more holistic approach to look at that average effect, because what the average effect shows is that cognitive behavioral treatment is effective at reducing recidivism, and because you've put all of these studies together, you get greater precision in your estimates. So we find that cognitive behavioral therapy is a statistically significant effect on recidivism. So one of the things that we sort of like to highlight for our legislature is that this is the reason why it's not good to cherry pick studies, because I could easily find any study that tells you, this is not a good program. And then I can easily find a study that tells you, this is a really good program. So it's the approach that we have sort of taken that I think that policymakers, both our legislators and legislative staff, really seem to understand that, this is a good, sound approach, because we can believe that what the Institute's going to share with us is not biased in any way, that they're not going to be cherry-picking findings. So what that effect size translates to is about a 6 percentage point change in recidivism. So if you think about it in this regard, and this is how our benefit cost model works, is we use these long-term 15-year recidivism rates, and we take that effect size and apply it to a base rate in order to do our cost-benefit analysis. And so without cognitive behavioral therapy, over that 15-year follow-up period, there's about a 66% chance of being reconvicted for a new crime. And when you apply that effect size to the base rate then, what we see is that the odds drop to about 60% change in recidivism. And I know probably what a lot of you are thinking of, and it's not, wow, that's amazing. It's, holy crap, that's a really high recidivism rate, you know. And it's true, it's a high recidivism rate, but what we have found is that even small effect sizes, because crime is expensive, even small effect sizes can produce significant gains in terms of financial monetary value. So yes, it is true that these are still alarming recidivism rates, but nonetheless you can impact them and on the whole have really important financial consequences. So benefit cost analysis then is essentially, what does it cost me to buy that lower recidivism rate? You know, what's the monetary value then of moving from a 66% recidivism rate to a 60% recidivism rate? And what's that financial cost to taxpayers and to crime victims? So our benefit cost model in a nutshell is we take what we know what works from either the meta-analysis or from our outcome evaluation, and we take that effect size, we apply it to that base rate that you just saw on the last slide to look at, you know, relative to a non-treated population. Here's the expected reduction in recidivism. And then what we do in our benefit cost model is basically, it's a probabilistic model where we're looking at, you know, in the event that a crime occurs, what's the probability that that crime is going to be reported to the police? And if it's reported to the police, what's the probability that either juvenile justice resources, either probation, parole, or detention, or adult corrections resources, or the courts, what's the probability that those resources will be used, and when they're used, how long will they be used for? So it's a combination of taking information about the underlying base population, applying that effect size to it, looking at the way that the criminal justice system behaves, and then getting to what's then the taxpayer savings from those fewer criminal justice system resources used. So here's a few examples of this cognitive behavioral treatment, then what that translates to, and these are per participant, and I should also mention that these are in US 2015 dollars. So per participant, that 6 percentage point change translates to about $10,000 in net benefits per person who participates in cognitive behavioral therapy. And then we see other programs too. Drug courts, that's one of our biggest meta-analyses. We have 70 effect sizes in that meta-analysis. It's about 10% change in crime. This is the number of studies included in the meta-analysis there. And that translates to about $8,000 in benefits per participant. I also mentioned, got ahead of myself, we don't always find good findings. Sometimes we find things that are ineffective. And this is one in particular, that this domestic violence treatment, and it's a very specific model. So not to be confused with all kinds of domestic violence treatment, but this Duluth model that's very rooted in sort of feminist theory of male domination over females. We've actually found that to have an iatrogenic effect of about 6 or so studies, and our domestic violence treatment provider community, they're not too happy with these findings, you know. We're trying to get them to change the statutory treatment standards, but you know, it's not quite there just yet. But and then I should mention too, this is the risk analysis from the Monte Carlo. So when we run the benefit cost model, then we can see of the 10,000 times that we've run the benefit cost model, what's the chance that the benefits did not exceed the cost, so that you can get sort of a magnitude of, you know, how risky is this potential investment. And what this says is that only 1% or less than 1% of the time when we ran the benefit cost model did the benefits not exceed the cost. So that's a pretty good investment. Then we also look at juvenile programs for juvenile offenders, and some of those can be quite effective and highly cost beneficial. You can also see too that there's, don't always find good findings in the juvenile justice programs as well, and Scared Straight being one of them. And so what that ends up being is then a cost to taxpayers to operate the program, in addition to the increased recidivism as well. And then we also look at prevention programs that also have crime outcomes. And there are prevention programs that usually measure a whole bunch of different outcomes, crime being one of them. So there are a few interventions like preschool for low-income kids, and then mentoring, school-based mentoring, that has an impact on crime outcomes and also produce favorable benefits per participant. So here's some new findings that I just updated and was talking about these last night. So this one I'm plotting for you here in regards to community supervision. So this shows a change in recidivism, more crime and less crime. And so for these different strategies, for intensive supervision, there are about 14 studies in that meta-analysis. And what we found is that intensive supervision is ineffective at reducing crime. This slide is changing. In fact, the results are changing because I've been updating these. There are new studies that are kind of coming out. So that's kind of one thing to point out, is that, we're not really living in this static world. We're living in a dynamic world where findings are changing as we update these meta-analyses. But we've found that intensive supervision with treatment does have a reduction in recidivism. And then when I look at supervision with risk, needs, and responsivity principles, and I don't know if many of you are familiar with that, but that's sort of, this risk, needs, and responsivity grows out of the Canadian researchers, Jim Bonta and Don Andrews, and their work. And so when officers are using this more of proactive, client-centered approach, and we were talking about this, I think, in a presentation that Carla was giving, which I really found very fascinating, but talking about, this sort of more client-centered, having empathy and working with the person, that those approaches are more effective, and this is one of those approaches. And so what we found is from 14 studies that it's also effective at reducing recidivism. And this is the more recent finding. I just finished this meta-analysis in November. There was a special issue on Swift and Certain that got published, and I was scurrying at the last minute to code all of these studies. And so there are 11 effect sizes showing that Swift and Certain, and this is the idea that you will address violation behavior quickly and so swiftly and with certainty, and that the length or the sanction for that violation will be a very short stint in jail. So we actually implemented this statewide in Washington State. So one of our studies, not the Institute study, but one of Washington's studies is actually in that effect. And so what we found is that although it's not as effective, as the other studies, it's a 4% change in crime. So the interesting part then about this is when you do the cost-benefit analysis is that you find that because of Swift and Certain's ability to reduce costs, and the reduction in those costs are coming straight from the reduced use of incarceration or jail for sanctioned behavior, that reduced cost then, what it means in concert then with the effect size is that this type of supervision is actually more cost effective than R&R supervision. So that sort of highlights, one of the reasons why it is important to look at cost-benefit analysis in addition to effectiveness as well. So one of the other key pieces that we have discovered over the years is quality assurance, and looking at whether or not program is actually delivered with fidelity to the model. And what we found in this example is results from an evaluation that we did at the Institute of Functional Family Therapy. And what we found is that For kids who are in the control, assigned to the control intervention, their recidivism rate was about 27%, so they didn't participate. For kids who did go through functional family therapy, but they had a competent therapist, their recidivism rate was about 17%. But for kids who went through FFT and didn't have a competent therapist, their recidivism rate was actually higher than the control group. So when you hear someone say you can't do harm, you got to get that out of your head, because you can do harm. And that's this is one of the most important slides that I always show, is that you really have to be looking at whether or not the intervention is being delivered with fidelity to the model. And these are not just findings that we have found. These are more and more researchers are starting to look at quality assurance and implementation, which I think is really very critical. And we've seen this with other studies too. In fact, one of those R&R supervision studies that was done by Ed Latessa in Cincinnati, they also found similar findings where the effectiveness increased with fidelity to the model. And then I've seen that within other studies as well. So that's something that we look for. And because of this, a finding on quality assurance, our juvenile courts actually implemented statewide quality assurance program for 4 different programs that are delivered to kids in the juvenile justice system. Risk assessment. This is another sort of core correctional practice, that is this concept of, adhering to this risk, needs, and responsivity model. And so I'm showing recidivism rates here, 36-month felony reconviction. And my former colleague, Robert Barnowski, he developed the risk assessment tool that's used in Washington State currently, although the Department of Corrections is moving over to a newer risk assessment soon. But this risk assessment, what it's showing you here is that recidivism rates over time for these are offenders who are classified as moderate risk for reoffense, that recidivism rates in Washington have been declining over time. And there's, recidivism rates for low-risk offenders. But I think more importantly, what this slide shows is the ability of our risk assessment tool to discriminate between people who are high risk for reoffense and people who are low risk for reoffense, so that this risk assessment is used to then help sort of facilitate people getting into programs, and it's also used to determine the sort of statutory contacts while they're on community supervision. And if any of you are wondering from Jerry's presentation yesterday, we do not include race in our static risk assessment. That is something that we don't do, and I think that some others do that. And because of some research that I've done, not for the Institute, but in my own time as a PhD student looking at racial disparities in the criminal justice system, they're very real. And so we did not want to build that into our static risk assessment tool. So one of the most important questions that we get asked, does our work actually get used, by the Washington State Legislature? And the short and simple answer is yes and no. It depends. It depends on what the findings are, and it just depends all around. But here are a few examples and instances where our work has actually gotten used. In the early 90s, which was before my tenure at the Institute, that functional family therapy slide that I showed you, that was some of our early work in trying to find effective interventions for kids in the juvenile justice system. And that actually came out of, there was an evaluation that showed that it was a program, and the program administrator said, my program works. And then it got evaluated, did not work. So what happened was we reviewed the literature to see what does work, what interventions can we use. We implemented those interventions, being FFT, aggression replacement training, multisystemic therapy, and then we followed up with an outcome evaluation and found that quality assurance finding. So that was some of the very early work that we have done at the Institute that's actually been implemented then in terms of policy making or affecting practitioners. cut prison bed sentences and divert that money into treatment. This one, which was mentioned earlier as well, and this is probably the one that got Steve on his round trip in Australia several years ago, was this report that we were directed to do by the legislature. We were very much in need of having to build a new prison, and the legislature said, what can we do to avoid having to build a $250 million prison? And so what we did is we did this massive systematic review of the literature and built this portfolio tool that we now still can use then, that says, if you were to reinvest into these programs or policies, you could in fact actually reduce the need for a prison bed. And the legislature, they did it. They funded $43 million that biennium in investment in juvenile justice programs, adult corrections programs, and a few prevention programs as well, with the goal of avoiding having to build a prison bed. And several years later, we actually shut down a prison, an old prison, and so so that's really good news, and some of the most important work that we've done at the Institute kind of came out of this report. And then incentivizing the use of evidence-based programs. This is sort of I'll throw a few of these up there, in fact, because they're all somewhat related. But now the state legislature is trying to financially incentivize institutions to use evidence-based programs. So you get financial credit then. So like for instance, the juvenile courts, they get block grant funding, and in their formula, they've built incentivize, the use of evidence-based programs. So the more you use the evidence-based programs, the more potential state-funded dollars that you can actually get. So building in that infrastructure, and then also building what we call these inventories, which are these lists of programs, that then the legislature has said, okay, you have to use programs that are on this inventory, programs that we know are evidence-based and effective. And so that's the direction that we're heading, not just in adult corrections or juvenile justice, but also in child welfare and children's mental health services and education as well. So we've already learned that some programs are effective at reducing recidivism. I mentioned too that prison itself is an evidence-based resource, but it's an expensive resource, so it's not effective for everybody. If you're going to incarcerate someone like my mother, you're not going to avoid very many crimes. So what we have learned is that incarceration really ought to be reserved for the people who are highest risk to offend. And we've looked at this empirical relationship just like we would, any other program or policy. We use our minimum standards of rigor and synthesize that research. So based on 7 studies, that have looked at the relationship between incarceration and crime. And so we've built this into our portfolio tool so that we can analyze different policies that say, well, if we are going to reduce incarceration for these folks, and we know because there's an empirical relationship between incarceration and crime, if we reduce incarceration, then crime will go up, then how can we reinvest in these other programs to offset that increase in crime that we would observe from incarceration? And we've also looked at the relationship between police officers, so police per capita and crime, and that's 9 rigorous studies that met our minimum standards of rigor and find that police officers are also effective crime fighters. So you're familiar with this, our CBT findings. So what we've done, and you can see here that's the $10,000 in benefits per participant, but we can do the same thing with police officers in incapacitation in our sort of portfolio tool. So if you look at, the cost of one police officer, it's about $89,000 per police officer, and then the bottom line impacts then are about almost $500,000 in benefits, that relationship between police and crime. And then same with prison. So if we look at, put these both up here, So if we look at lower risk offenders, so you're decreasing prison ADP, it's a savings. So that's why it's in green here. That's green, Dawn. That's red. So if you're decreasing prison, the need for prison beds, then it's a benefit to taxpayers, but also crime will go up. But what we see is that when the net benefits for reducing the incarceration for lower risk offenders, those net benefits outweigh the costs. But not so for higher risk offenders. So a few cheat sheet on some evidence-based principles, much of which I've talked about. This is sort of reiterating the need for looking at not just whether or not something works, but also whether or not it's cost effective. Quality assurance and oversight, that's also very important, and something that our juvenile courts have been very good at that, but our Department of Corrections is just now starting to get into doing quality assurance for their cognitive behavioral programs. But it's also important to keep revisiting that path, because there can be program drift. And just because you've evaluated the program one time doesn't mean that you're necessarily continuing to get those same results. So you should always continue to revisit it. There's substantial research out there to sort of show that risk, needs, and responsivity over time, that those principles are very important. One that we're seeing over and over again. Oops, I'm sorry. And then punishment. What we found, and this is by looking at the Swift and Certain literature, but also looking at prison length of stay too. We've meta-analyzed the relationship between the length of prison sentences and its impact on recidivism. And there's a tiny, minuscule effect. It's not very big at all. But so what we have come to conclude is that in terms of punishment or deterrence, that there's good research evidence out there to support Swift and Certain principles, but there's not good research out there to support severe or more punitive principles. So some of the lessons that we've learned, in Washington is to encourage these budget drivers and monitor the results. Research and development, we've allowed through this inventory process that we do for promising programs, because if you allow for promising programs that are sort of grounded in these logic models, then you have the ability to address local needs and also the ability to evaluate new programs to potentially expand the list or the menu of options that people can invest in terms of programs used. And that policy making is a people-oriented task. I can be a very impatient person, and I think one of the biggest things that I've learned over the years is that, I have to be patient, because the people in the world that I'm working with, the stakeholders change, the people change, so it's always important for me to be reaching out to those people who are using our findings, to be reaching out to legislators, other researchers, and to be patient that public policy making is not a linear path. You're kind of moving forward and backward. And I would also like to say too that our objectivity at the Institute, because we're a nonpartisan research entity, that does kind of give us a lot of leverage. One, in terms of, we are legislatively mandated to study things, so it makes my job a lot easier to say, I will be breaking the law if I'm not doing this outcome evaluation. I am supposed to be doing this outcome evaluation. But also just that nonpartisan nature, I think, gets people to sort of really believe in the findings. And I often hear, when there's discussions, during legislative committee hearings, and they say, what does the Institute say about this? So what's the cumulative effect? Using our benefit cost model, in investing in all of these programs sort of historically over time, we found that as of now, we sort of use our benefit cost model to kind of backcast to see what do we think the effect is on the prison population, and we think that we have saved, because of all of these investments in evidence-based programs, about 1,600 prison beds, which is about an entire prison, because of these investments in evidence-based programs. So that's it.
Thank you very much.
Thank you.
We've got time for a couple of questions. One down here. We'll go straight to that one. Thank you.
Australia's got a growing social impact investment market. Australia's got a growing social impact investment market, and less so in the criminal justice area, more in kind of housing and human services to date, using social impact bonds and payments for outcomes contracting and so on. It's pretty resource intensive the way Australia tackles it at the moment, in that providers are kind of responsible for the evidence base around outcomes, and then the collaboration with government to build the economic picture it's very intensive. This is a dream come true in terms of an evidence base for that sort of market. Has it driven a big social impact investment market in Washington?
Well, you know, I would say just by the inventories and the sort of requirement to, you know, if you're going to use state dollars, you got to use them on programs that we know are effective. So you're at least, you know, hedging your bets then that, you know, we're not using programs that we at least know are ineffective. So I think in that way, and those have been more recent, you know, developments to actually tie budget dollars to investments in programs. I mean, we're seeing that kind of pop up more and more, and that's occurred in, you know, juvenile justice and these services, the Department of Social and Health Services, the ones that they deliver, that they're required to use a percentage of their budget on evidence-based programs. Does that, I don't know much about social impact bonds.
You know, that sort of answers my question.
Okay.
Thanks.
Beth, very quickly, I'm over here. Very quickly, you mentioned about Washington State and cannabis decriminalisation. I would have thought that was very equivocal. Were you behind that? And if not, why?
Not me personally. In fact, it was a voter initiative that it was, I think, brought about by the American Civil Liberties Union, and they got it on the ballot, and that is our one and only study assignment by voter initiative. So we're written right into the ballot.
Okay. We've sort of run out of time, so I'm sure Beth would be available for questions over lunchtime if anyone wants to carry on. I have, well, the third time we've given out this particular present. Yes. So some of the artwork, thank you very much.
Thank you so much.
And can we please show our appreciation?